Welcome back to my diet and pain video series. Let's talk about low back pain. My first considerations with chronic or recurrent low back pain and injuries outside of the bones, muscles, and ligaments from a functional health perspective are intestinal stress, blood sugar abnormalities, and emotional stress. Please keep in mind all of the info that we discussed about stress and how it impacts our ability to heal and stabilize joints. When it comes to the low back, one of the most common causes of issues is related to stress on the intestines. This can be related to food allergies or sensitivities, emotional stress, spicy foods, not chewing your food well, dysbiosis or poor microbial health, and alcohol intake. Intestinal stress will typically have an impact on muscles of the low back and the abdomen, along with the muscles that move the leg forward and backward, as you'll remember from the knee pain video. Remember, the primary protective mechanism of joints are the muscles. When internal stress impacts the reaction time of our muscles, they decrease their ability to move and protect joints during normal movement patterns. Decreased reaction times of primary movers may result in recruitment of secondary and tertiary movers that aren't designed or positioned to support the body through normal movements. Because muscle function may be impacted by stress on organ function, like the large and small intestines, back pain may result with movements that are considered to be normal, such as bending over, leaning backward, leaning to the sides, or twisting that cause pain. Blood sugar abnormalities have many impacts on health. One of those is the impact on postural muscles of the spine. Chronic blood sugar abnormalities create stress on the parts of your brain that control the postural muscles of the spine due to deficient availability of fuel. The deep postural muscles that are primarily responsible for postural stability are not consciously controlled. Therefore, even if you exercise and work towards strengthening your back, if you have chronic blood sugar abnormalities, your deep postural muscles may be negatively impacted, resulting in pain and over time disc problems. This happens because the spinal joints are first protected by the muscles that move them, then the ligaments that hold the bones together, then lastly the ability of the bones to withstand stress. Chronic blood sugar stress negatively impacts the function of the postural muscles. This increases the strain on the ligaments that hold the intervertebral discs in place. Over time, the increased strain on ligaments weakens their integrity and may result in bulging or ruptured discs. This may result in pain that radiates down one or both legs. Stabilizing blood sugar should always be at the forefront of any plan to improve symptoms related to chronic back pain. Next, persistent emotional stress may have a negative impact on the muscles related to the low back. This is very common with back pain that begins after normal benign movements. This could be picking up a pencil, getting out of bed, or any number of minor activities that should not cause your back to go out. Persistent emotional stress will increase ligament flexibility, which can increase the force applied to the ligaments that support the spine and disc. Again, remember that joints are first protected by the muscles that move the joint, then the ligaments that hold the bones together, then lastly the ability of the bones to withstand stress. To tie it all together, if emotional stress has been high, the ligaments that hold the bones of your spine together allow more joint play. If you combine this with suboptimal muscle function from blood sugar abnormalities and/or intestinal stress, you begin to create an environment that will be more prone to low back pain. Of course, there are other muscles, organs, and adaptations to stress that may impact the function of the muscles related to low back. However, these general categories have a substantial impact on low back muscle function and pain that will help build upon the general pain information that I mentioned in my other videos. I've created an online course called the DIY Health Assessment Course. It's a quick and simple way to organize your symptoms and labs in a way that will help you understand what changes to make so that you can recognize and reduce the stress you didn't know you had to begin your journey of decreasing pain and improving function. Also, if you want a quick reference source to help you make changes to your diet and lifestyle, check out my book, The Path to Health, a manual for proper care of the human body. Thanks for your time, and I hope this information helps broaden your perspective on how diet and lifestyle impact your pain, your ability to heal, and helps you get on your path to health. I'm Dr. Richard L. Robles. Thank you.